All right, well, welcome everybody. My name is Emil Doak. I am Vice President for Advancement and Programs here at the American Conservative, and I'm thrilled to welcome all of you to our fourth annual Crony Capitalism Conference, albeit a virtual edition this year, called Healthcare Under Siege, How Industry and Government Collusion Created a Crisis for Consumers. Our mission at the American Conservative is to advance a Main Street conservatism. That's one that opposes unchecked power in government and business, promotes the flourishing of families and communities through vibrant markets and free people, and embraces realism and restraint in foreign affairs based on America's vital national interests. In that vein, this conference, and really the larger crony capitalism initiative of which this is a part, is an integral part of our work. Vibrant markets require genuine economic competition, competition that is free from the government handouts that too often reward global conglomerates with armies of lobbyists over the mom and pop stores on Main Street that are the lifeblood of our flourishing communities. Our crony capitalism initiative is our answer to this problem. It fosters support for fiscal restraint and a genuine free enterprise economy in order to build an economic future that is more rewarding of innovation while being less reliant on debt, government lifelines, regulations, and bureaucrats. As we survey this strange year, it's evident that there's perhaps no sector more plagued by cronyism than the healthcare industry. Healthcare spending continues to rise, topping $3.8 trillion in 2019, which accounted for nearly 18% of our GDP. Yet at the same time, nearly a decade after the introduction of the Affordable Care Act, affordable quality medical care and prescription pharmaceuticals remain out of reach for many Americans. It's no surprise that healthcare remains one of our most hotly contested political issues. Anyone who's tuned into the ongoing hearings of Supreme Court nominee Amy Coney Barrett can attest to that. In this year of COVID, when our healthcare system has been put to the test, we'll examine the role that cozy ties between government and big business have played in creating the current inefficiencies of our healthcare system that drive our political discourse. We have two excellent panels lined up for you today, but I first want to introduce our first speaker, Ambassador C. Boyden Gray, who will frame our conversation. Ambassador Gray is the founding partner of Boyden Gray and Associates, a law and strategy firm here in Washington that focuses on constitutional and regulatory issues. Mr. Gray worked in the White House for 12 years, first as counselor to the vice president during the Reagan administration, and then as White House counsel to President George H.W. Bush. In 1993, he received the Presidential Citizens Medal, and under President George W. Bush, Mr. Gray was ambassador to the European Union and U.S. Special Envoy to Europe for Eurasian Energy. Mr. Gray is an adjunct professor at the Antonin Scalia Law School and a member of our board of directors here at the American Conservative. So Boyden, welcome, and I will kick things over to you.
I want to use as an example just one case which is of some relevance to COVID. What we see in the drug industry is what we see with hospitals and insurance companies and what all. What happens with competing drugs is disturbing. And the drug that has gotten incredible notoriety, called hydroxychloroquine, is actually a drug that probably works and probably works well, especially as a kind of therapeutic like Tamiflu, which if administered early in the progression of the virus, can dramatically reduce symptoms and in all likelihood keep you out of the hospital and keep you out of serious trouble resulting from having contracted the virus to begin with. There are many studies that show efficacy, but since the very, very beginning, these have been trashed, ignored, suppressed by the mainstream media and opposed by the government elite. Dr. Fauci, who is, I think, rightfully understood as the country's leading spokesman on the issue of this current virus, has also jumped in and said there is no value to this drug, which I think is a mistaken, very, very badly mistaken um, view. The if you match up the studies that are positive with the stories that are negative, you would think you were living in two separate worlds. Um, there are two or three major studies do that do show efficacy, and there are myriad smaller studies, um, not just here, but all over Europe, where it's used widely, and it seems to be effective. It's used obviously widely in Africa because hydroxychloroquine is a drug that is approved by the FDA for malaria treatment, lupus, and arthritis. So it's an approved drug. It's something that the FDA has already approved. It has been used by 2 billion people without any really noticeable, significant adverse health events. So it's a very safe drug, very well understood, promoted by the WHO before the COVID virus took hold anyway, as one of the most important drugs on the world market. You can get it over the counter in almost any country in the world except here. You can't, in some states, get it at all. You can get it in Iran over the counter if you want to, but you can't really get it here. So why the lockdown? And that's, I think, a case study in the collusion. I think the reason is because there may be some anti-Trump feeling in all this, that somehow if this drug were found to be useful, he would get credit and maybe improve his standing on this COVID issue. But I think the motivating factor is that there is really no money in it. It's not a moneymaker the way a new drug is that can charge very high prices. It's a 70-year-old drug that's off patent, off everything. It's 10 cents a pill or something. There are millions of doses that are available. Remdesivir has to be administered at the hospital at the moment. The monoclonal antibody treatment that the president got and that Governor Christie, is going to be in limited supply. The only drug that is readily available, cheap, is hydroxychloroquine at the moment until we get a vaccine. And even when we get a vaccine, I'm not sure it will be that much more effective than the therapeutics that are being developed, but not necessarily rush to market because some of them involve pre-existingly approved drugs and not money makers for the pharma industry. So, and not helpful to FDA. So this is what I hope that people will think about as this program unfolds. Is the dangers of allowing this collusion between government and big business to freeze out competitors, cheaper alternatives, however you want to call it, but to, at the very end of it all, is a suppression of competition, which does more to spur innovation and lower prices than any other behavior that I know of, any other discipline I know of. And antitrust principles are totally lacking. I will end with just a story of a couple of the publicity events that occurred. There was an outpouring of media which really did kill the drug after Lancet, which is the most admired public health journal, published an article that really was very, very negative about both efficacy and safety. Less than a week later, or about a week later, they had to retract the story, and the editor said that the study was a, quote, these are his words, monumental fraud. And at that point, the EPA basically stopped use of the drug, which it had previously authorized in hospitals. Not that it should have any control at all, because it is an approved drug. After this story came out, there was a study by Mount Sinai Hospital showing a 50% reduction in mortality if used early. That study has really never been disclosed in any of the major media. Then the Henry Ford hospital chain came up with a study that showed roughly the same thing. They asked for permission from the FDA to do more work to study the value of this drug in various settings, especially in early use. The FDA said no, basically making any further discussion, let alone study, let alone discussion of this drug. And so it's, for all intents and purposes, dead. But it shouldn't be, because it continues to be prescribed with, I think, great success in all parts of the world. And in Africa, just to go back, Africa has one of the lowest rates of the virus of any continent. And I think it's entirely possible. It's because hydroxychloroquine is so widely available and used against malaria, which is common, obviously, in Africa. This is the African continent is not the only example of that. There are other examples. But we need to have more debate, more discussion, more transparency about what all this is about. And I'm afraid, for the moment, it's been cut off. This is not surprising. This business of cutting out your competition is as old as Adam Smith. That was his worst nightmare, that some business units would capture government for their own purposes, erect barriers to entry for competition. So this is not new, but we really ought not to tolerate it. And I hope the panel discussions that follow will open your eyes even more to what is going on. Thank you.
All right, thank you, Ambassador Gray. If you guys would like to read more about that topic, there's an excellent piece up at our website at theamericanconservative.com, written by Ambassador Gray. It was just published yesterday, which I've just sent to the chat box there. Next, I'd like to introduce our keynote speaker today, Joe Lonsdale. Joe is a co-founder of Palantir, a multi-billion-dollar global software company best known for its work in defense and finance. More recently, he was a founding partner at Formation 8, one of the top performing private funds and the precursor to his current investment firm, 8VC. Joe also founded Adipar, which has over $1.8 trillion managed on its wealth management technology platform, and OpenGov, which modernizes various processes for over 2,000 municipalities and state agencies. Joe received a BS in computer science from Stanford in 2003, and he often lectures and writes on entrepreneurship, technology, and public policy. So Joe, welcome, and I will kick things over to you.
Awesome, thanks for having me. Hello, everyone. Going to talk a little bit about, I guess we're all talking about healthcare today, which is obviously at the center of American politics. I guess it's the most important political issue even before coronavirus. I remember I was talking to Kevin McCarthy about this. I think their polls showed they lost on healthcare last time by something like about 40%, between 35 and 50%, depending who you ask. But normally when you lose on an issue, you lose by 5% or 12%. So the right's just gotten completely slaughtered on this issue. If we'd only lost, I think, by 20%, they would have kept Congress last time. So given we're speaking at this conservative conference, this is obviously the most important thing to fix politically. And obviously much of our economy today is healthcare. Just to put it in context, about $1 out of every $5 we spend in our economy is spent on healthcare. In government spending, on the federal level, it's $1 of every $4. On the state level, it's $1 of every $3. So this is obviously a huge problem. It's only being accelerated by our current pandemic. And you can't look at healthcare without looking at all the wasteful spending, the corrupt insiders, all sorts of ridiculous charges. And you really have to lay this at the feet of both parties. Republicans and Democrats are both captured in ways that have led to laws, that cause, expensive treatments we don't need, prevented the use of insurance contracts across state lines, and just made sure markets do not work in healthcare as they do everywhere else. Like our free society has certain reasons it works, and those things do not happen in healthcare. And so what we need to focus on is we need to focus on making healthcare resemble a free market as much as possible, reject cronyism in every instance, and harness competition wherever possible. We're not going to be able to go from here to a free market. That's naive. If you think you can make healthcare perfectly a free market, that's not true. We're not going to get rid of some of what government does. Government's going to be involved in some of it. So therefore, our job is not to be stubborn libertarians and sit there and yell at our TV screens about liberty, but it's actually to say, how does a free society work, and how can we emulate it as much as possible to have the choice and competition? And there's going to require a lot of courage. A lot of us are very quickly call out the left for government unions and how government unions are completely in charge of parts of the left and they're unreasonable. We have to be honest that actually the right is also very influenced by these interests. And a lot of people here today who are speaking here today also have to get money from some of these cronies. And so it's very, very hard for a lot of us to sit back and say, we're actually going to attack and do the right thing here. It's very easy to attack certain things and then try to protect the golden calves, basically, of a lot of these cronies. So if you want to look at the right, four of the six biggest donors in Washington in healthcare, the American Medical Association, the American Hospital Association, Blue Cross Blue Shield, and the Pharma Association, mainly donate to Republicans. So you have the four of the biggest six, completely corrupt, completely anti-market groups that a lot of people here take money from. Like they're mainly supporting Republicans, and they're keeping the ability for us to not have functional open markets and competition. They're keeping out competitors. And so, and why is the right feeling on healthcare? One problem, of course, is it's really complicated, so it's hard to get basic facts across. I think at the moment, Britain spends about $3,000 per person with NHS. That covers everyone in Britain. Our government spends about $5,000 per person, and it obviously doesn't even cover everyone. So there's obviously a huge mess here. It's not going to be solved by more money. And so the question is, like, how do we map this out? How do we stand up to it? Well, there's a few obvious high-level things to do. I'm going to go over each of these areas. For starters, we can give something people actually want rather than have socialist stuff where we run things. You can give them the money themselves. The one, HSAs, health savings accounts, is one version of that. Instead of the government setting the price for knee surgery, for eye exams, etc., you can let poor and older Americans take cash subsidies where they will. And consumer shopping, obviously, in these areas would drive down prices and create markets. Ovik Roy has proposed a lot of good stuff recently, including a plan that does this instead of what we currently do for Medicare and Medicaid. We should support this. At the same time, we should make sure the government no longer forces people to get insurance from their employer. That's obviously a huge part of this problem. Some people call it the original sin of healthcare. And instead we can allow employers to put money into these HSAs to basically let people do this. There's a lot of good plans talking about this. Both Roy and Senator Rand Paul have proposed bills that do this. We should support that too. But I think the bigger thing for me is the hundreds of crony laws in each of these areas. And what you have to do is you have to go through the types of players in the healthcare system one by one and say, how are these players restricting competition? How are they stopping people from having choice? So if you review these, let's start with Democrats' favorite is the insurance companies. The insurance companies, although I don't think they're the biggest problem, they are part of the problem as well. They found lots of ways to segment the market by making sure every state has its own rules and regulations, keeping out competitors in each state. So one of the obvious things to do is to open that up. There's lots of other crony things that they're doing to force you to work with them versus doctors directly. Doctors is another group that's found a lot of ways to prevent competition too. The Committee on Medical Education ensures that accrediting a new medical school takes 8 years on average these days. I mean, it took us like a year or two to get things right to fight World War II. It takes 8 years to build a medical school in America these days. It's completely incompetent. And the limited number of medical school slots explains why we have around a shortage of 30,000 primary care doctors. Just adding these competitors, basically new entrants, would drive down prices a lot, save about $100 billion a year. So lots of good examples for doctors groups. We actually recently in California got rid of a law and allowed nurses to do certain things with midwifery that doctors were preventing. So there's all sorts of these laws everywhere that the doctors have created. One of the favorite bugbears of the right, which is a bad one, is tort lawyers. Tort lawyers is about $50 billion a year of medical spending. It looks like perhaps even more because of all the defensive medicine that they're causing. Texas has shown good results attacking that and fixing that by capping medical liability payments and $250K. So there's a lot to do against tort lawyers as a crony part of medicine. Hospital chains are probably the biggest one, in my opinion, that are the problem. Basically, you have all these local hospital systems that are just become complete monopolies. A lot of them have turned themselves into nonprofits And so they're nonprofits. They say, oh, we're nonprofits, therefore we can't be bad. But they actually have giant contribution margins and are paying all these people and their families huge amounts of money. The FTC should be going after both for-profit and nonprofit local monopolies that are basically cartels. And we should be opening it up. We should get rid of certificate of need laws. Certificate of need laws is a great way for a hospital to basically just say, like, don't allow competition because they don't need it. Because if we have it, obviously I have to lower my prices. So certificate of need laws are a joke. You should completely get rid of those and fix that. You basically, basically right now hospital chains charge Medicare, Medicaid oftentimes more than twice or three times as much for the same services. That's not a market, that's broken. So the hospitals in general, very, very corrupt, very dysfunctional, should be going after all of them. Most of these services are better provided, not by hospitals, but by health clinics to split it out. And they can do things for half the price. So that's like and it sounds bad because you're like, oh, how could you be against your hospital? But this is actually like where the majority of the problem is, in my opinion. It's just like completely corrupt. The FDA is a huge part of it. So as you guys know, we're going through a really exciting renaissance in biology right now. There's tons of new, really high potential drugs coming out. And we're basically losing our edge though to European counterparts that, for example, medical devices come to market 3 years earlier now, often in the European and Europe than the US. The cost to get drug to market's almost tripled in the past 20 years. And if I was in charge of the FDA, if you had more competent people in charge of the FDA, you would have competition within the FDA. So I think there's a lot of people who are very well thought of who run the FDA recently. They're invited to speak everywhere, and they're cowards. And they're cowards because they would not reform it. They would not create competition. They would not make it easier and faster and cheaper to approve drugs. That was the real hard work you had to do versus just going on and bloviating on 50 conferences. Is you actually like put real competition into these things. You speed up the FDA, you cut the price. We need real serious leaders willing to challenge the kind of deep state within the FDA, force them to go faster, force them to take more risks because it would save more lives by taking more risks. It's very easy to just say no to everything and therefore say you're saving lives. You actually kill more people by taking it longer. So huge amounts of problems there. Love to get a presidential administration who would put competent people in to actually fix the FDA. Didn't get it this time. And then of course, even PBMs are another huge problem. There's 3 of them that are a cartel that control most. PBM stands for pharmacy benefit managers. They eat up a huge part of the spending each year as middlemen. And, they've placed all sorts of gag orders in their contracts. So we talk about markets. A lot of Republicans, I think naively say that, oh, contracts are contracts and that therefore that's free market. There's no way markets work better with gag orders, whether it's on prices or whether it's on anything else. Gag orders do not help markets work. You are wrong if you think that gag orders help markets work. We passed 97-0 in the Senate 2 years ago. They got rid of certain types of gag orders where the pharmacists are now allowed to tell about equivalent generic options. Pharmacists are still not allowed to report the prices they are paying. They're still gagged by this cartel. And the cartel has spent billions of dollars lobbying, paying think tanks, paying senators. And you go and you talk to people who work for these senators, including on the right. They don't have very high IQs many oftentimes. And they say, oh yeah, Joe, if we had transparency and they'd coordinate and the prices will go up. And I'm sorry, but I've built a lot more businesses than anyone else in this thing. Prices do not go up when you have transparency. Prices go down because we can create things we compete. So it's completely corrupt thing there. Republicans are also very guilty of. Need to fix that and need to stop these cartels from stopping transparency. Basically, the providers basically have charged differ as much as 500% for the same procedure in the same region, and it's because it's secret. The federal government with Trump has tried to put executive order demanding more price transparency, at least from hospitals, on about 70 shoppable procedures, something a lot of smart people have worked on. It's obviously being fought, and I'm really worried they're going to kill it, but hopefully we can get that out and actually enforce it next year. So there is some bright spots here being worked on by some of the policy people in the White House. But I think that's the key thing is all these areas. And now, of course, the one bright spot in America, and I think America does lead in, is innovation. And as a lot of you know, we are going through a renaissance in the biology world. There is a ton of innovation happening right now. There's a ton of innovation happening in healthcare IT as well. So those are the 2 bright spots that actually should allow us to bring down prices a lot if we can let them into the market, if we can open it up. I'll give a couple quick examples of those. One example is, you guys probably know Oscar's new health insurance company. I personally put a lot of money into a lot of these new companies in all of these areas. In this case, you have technology that helps virtualize high quality primary care experiences. And so you make prevention available to everyone for much cheaper while maintaining the lowest premiums. There's a lot of things like that. Another example I really like that I think shows what's possible here in these areas is something called City Block Health. So what you could do You take people who are the most expensive people on the plans because they're homeless, because maybe they're on drugs, maybe they have whatever else their problems are, their mental health issues, and you actually invest a lot more in them up front, and you give a lot more. You get actually social workers going to them. You get all sorts of these money going to them to help them. And what it does is it actually saves about 40% of the cost because they don't end up going to the emergency room as much. And so because we have this risk thing now, you're actually able to invest more in people who need it because in America right now, we don't have enough primary care. So this actually saves a lot of money. They're going to do something similar in rural health as well. The new rules let you actually do more primary care for rural health, which then ends up bringing down the cost. You can share on the cost savings. So it makes it profitable now to invest in these things. So there are some really, really positive things coming with reforms with how we do risks. But you know, in general, the best reforms in our country that we need to do are going to pare down the government restrictions. They're going to liberate innovators, and they're going to allow new techniques to expose and replace the corrupt and hidden corners of our system, where insiders reap profits by milking taxpayers and consumers alike. And a smarter healthcare system will return choice to consumers. It'll cultivate market competition where it's been destroyed by corruption, and deliver innovations across the board, you know, from biological sciences to healthcare data, improve outcome and lower prices. And conservatives are still looking for ways to rhetorically reject state-sponsored healthcare outright in favor of entirely free market solutions. And that's not where we are right now as a society, and it's not what's going to work here. Instead, what we need to do is figure out how to focus on making state-sponsored healthcare resemble a free market as much as possible, and then reject cronyism one by one in each of these forums for each of the market players, and reject other bad government policy in order to harness the principles of markets and a competition of ideas wherever possible, so the good ideas win and the bad ideas lose. And you know, we're not going to agree as a society as how much we should spend on healthcare and how much government should be spending on healthcare, but we can all agree we should be spending it more efficiently. And so the good reforms and the anti-cronyism here is necessary and obvious. I look forward to discussing it more.
Great, thank you, Joe. Certainly gives our panelists a lot to unpack. I'd like to move into our first panel now. It'll be called Middlemen, Markups, and Cronyism in the Age of COVID. And joining us will be Robert Graboyes, Senior Research Fellow and Healthcare Scholar at the Mercatus Center at George Mason University. Avik Roy, who is President of the Foundation for Research on Equal Opportunity. Joe Lonsdale, from whom you just heard. And Anne-Marie Scheiber, Research Fellow at the Heartland Institute and Managing Director of Healthcare News, who will be moderating our discussion. So Anne-Marie, I will kick things over to you.
Well, thank you, Emil, and thank you and good morning. I'm very pleased to be here to discuss this worthy and urgent topic. And thanks to the American Conservative, excuse me, for organizing these crony capitalism discussions each year with healthcare being at the forefront of this problem. You know, Joe was right earlier when he said that people, when asked about the important challenges facing the country, they seem to mention healthcare and the economy in one breath. They've become almost one and the same. You know, in 1970, healthcare spending amounted, it's amazing to believe, if you added up all the money, it came to about $355 a person annually. In 2018, it is now over $11,000. Now, if you took that $355 and put it in one of those inflation calculators, it would really only come to about $2,400. So our task here this morning is to figure out where that $8,700 per person has gone, the middleman. So fortunately, we have an A team with us to help us figure that out here today in 30 minutes. We met them briefly, but I'll say their names again. Dr. Robert Graboyes is a Senior Research Fellow and Healthcare Scholar at the Mercatus Center at Georgetown University. Joe Lonsdale, who you just heard from, founding partner of 8VC and co-founder of Palantir. He also launched the Cicero Institute, which explores some of these solutions to public policy problems. And then Avik Roy is the president and founder of Foundation for Research on Equal Opportunity, FREOP, with 2 Ps, and you see his byline quite a bit and on the screen talking about healthcare. So I would like to cover the big 4 challenges: insurance, hospitals, doctors, and pharma. I thought it would be good to start out with a question for all of you to answer at the beginning and the end, and then I'd like to direct a specific question to each of you in the middle. We have, again, a half hour, so we're going to have to keep our answers pretty brief. But my first question to everybody would be about this middleman amount that I alluded to earlier. Has that really helped advance healthcare in any way? I mean, certainly we've had population growth in the last 38 years, but as you know, we shouldn't be sicker. Standard of living has gone up and we're not living to 150. So where is that money going? Maybe we could start first with you, Dr. Graybois. Bob.
Sure. Hi. Um, Edward George Mason University.
Oh, I'm sorry.
That's okay. Got to get the plug in there. So, can't say that middlemen haven't added value in all of these years. I have a lot of views on why we're spending so much, and I actually am somewhat of a dissenter on that, thinking we're probably spending about the right amount of money on healthcare. It's just we're probably not getting as much. We are certainly not getting as much out of that spending as we should. I think the middlemen have certainly contributed, including the ones that you questioned there, some of the PBMs and whatever. However, the things like the Medicare reimbursement rules have certainly locked into place a status quo in the supply chain. And the relevant question is not whether they have added some value, which I think they certainly have. The question is whether alternative institutional structures would have added more value. And I'm quite confident that they would have. The current rules we have prevent the markets from experimenting with those alternative structures.
Ovik, what are your thoughts?
Well, first of all, let me just echo your thanks to the American Conservative for having this program and being concerned about this issue. When we started FreeOp in 2016, in the 4 years since, we found that this is the single biggest obstacle to showing how free enterprise can help all Americans, is crony capitalism, the incredible power of big businesses that construct rules and subsidies in their favor and against people who would make goods and services less costly for Americans. So this is an incredibly big problem. It's a lot easier to talk about than it is to actually do something about. So we got to start somewhere. So I'm glad we're having this conversation. And the thing that I would say, Anne-Marie, that may, at the risk of being impertinent, is that while middlemen are a problem, and the biggest middleman in healthcare that's a problem is the government, the way the government basically takes our money out of our paycheck before we even see it and then gives it to the healthcare system. That's the biggest middleman. That's the problem here. But at the end of the day, where is the money going to? The money is going to the drug companies. The money is going to the hospitals. The money is going to the doctors. And yes, there are middlemen that are involved in processing those transactions that get their cut. But the pharmaceutical industry wants you to think that all the profits are going to the middlemen. They're not. They're going to the pharmaceutical companies. And in many ways, not because of rewarding innovation, but because of a rent-seeking behavior in which they're taking advantage of government-enforced monopolies and government-enforced subsidies and government mandates that force you to pay for their drugs regardless of the price, regardless of the value. And that's also true when it comes to hospital care, when it comes to physician care. So that's the biggest problem. The biggest middleman here is the government. And the biggest driver of healthcare inflation, you started talking about, Anne-Marie, about healthcare inflation. Why do we have this massive healthcare inflation? It's because, as many of you know, and as Joe alluded to, the original sin of our system is that in World War II, we said that we were going to exclude from taxation, I'm sort of abbreviating the story here, the cost or value of health insurance. And as a result of that, ever since, we've had the system where your employer has an incentive to give you more money in the form of health insurance than in the form of an actual paycheck. And so health insurance became more than, think about auto insurance. Auto insurance just covers you if you total your car gets stolen, doesn't cover your gas or your oil change. Healthcare covers everything because there was this mission creep where you were getting these subsidized dollars. And we're at a point now where the tax subsidy for health insurance in America is worth about $300-400 billion a year. It's the second or third largest entitlement in the country, depending on how you count it. We spend more money subsidizing healthcare in America per capita than any other country in the world by far, and we still have 30 million people uninsured. So the real problem is that the middleman is the government, and how do you change that? And that's been the focus of a lot of our work at FreeOp, is to figure out ways to put the consumer, again, in charge of the dollars that are being spent on his or her behalf. Once you do that, you can actually enact a lot more changes. But you also have to tackle the big problems of monopoly power, particularly when it comes to hospital care, prescription drugs, particularly biotech drugs, biologic drugs, and certain kinds of specialty physician and surgical care like anesthesia, where in a small city or a small town, a single group of physicians basically is the equivalent of a monopoly.
Joe, would you like to pick up on that theme of the government now being the largest payer of healthcare and the corruptive force that creates in a particular industry?
Yeah, there's a lot of different ways to handle this. If the government's going to be the largest payer, you have to kind of say, like, what would the market normally look like if this was actually a really big business instead? And that's what you have to go with. And so if it was a really big business instead, what it would do is it would negotiate. And it's really awkward for government to negotiate, because who are you negotiating against? Whenever the government negotiates, it's basically going to be captured. So the only way you can negotiate fairly in this case is to just use some kind of other standard of other big payers. And so to me, the obvious answer is the best deal for the people of America is to negotiate as best as possible using whatever else is out there. If pharma companies are willing to sell drugs in other countries for a certain price, then we should not be paying more than what those other people are paying, because those are the peers. That is how big businesses would work. They'd say, we're not going to pay more than our peers. And so I thought the IPI made a lot of sense, and not surprisingly, pharma lobbied and was able to kill it and call it socialism and trick conservatives to say, oh, government should be paying a lot more and being a lot more crony because it's socialism, when actually it's just like, that is how it would work in a market, is you negotiate using the IPI. So I'm really frustrated that we killed this thing where government was not allowed to pay less by using the index from other countries, and basically we're giving a better deal to other countries because we call it socialism if you want a better deal. So it's, anyway, there's a lot there, but the main thing is, like, pharma lobby and other lobbies should be stopped from stopping us from negotiating if we are going to be involved.
All right, Ovik, I'd like to direct the first two issues to you directly about hospitals and doctor bills. So can you maybe tell us a little bit about why hospital bills are so expensive? We talk about cost shifting. They often blame cost shifting for one of the reasons why private consumers pay so much. And then on on physician fees, what I find so unusual is we talk about this demand for primary care physicians, but when you look at what we pay for specific doctors, orthopedic surgeons command the highest dollar. Primary care physicians are in the bottom rung. How do we even come up with these prices that we end up paying for physicians?
Yeah, those are both big questions. We could spend basically all day talking about both of them. So I'm going to give a very superficial description. In terms of the first question you asked about cost shifting. So just for the listener who or viewer who isn't aware of this, so there's this argument out there that has proven attractive to conservatives because it massages our prejudices, that the reason why private health insurance is so expensive in America is because Medicare and Medicaid underpay hospitals and doctors for the care they provide, and therefore hospitals and doctors have to overcharge the privately insured to make up the difference. This actually turns out not to be true. In fact, there's an enormous amount of evidence at this point, and I can bore people with this ad nauseum at our website, that basically what happens here is that hospitals and doctors charge what they can get away with. And sometimes actually they charge less than what they can get away with and realize later and charge more afterwards. So we're not seeing that in fact. In fact, the spread between what Medicare and what employers pay, for example, Medicare's rates have tracked healthcare inflation, roughly speaking. Employer-based, what employers pay hospitals has tracked it like several points above that, to the point where now, in a lot of places in this country, what private employers pay for the health care for their workers is 3 times or 4 times what Medicare pays for hospitals. Hospitals, according to MedPAC, the official government advisor to the government on Medicare, they basically come out even, roughly speaking, and that's based on fairly artificial and non-market-based descriptions of cost. Basically what happens is hospitals most hospitals are nonprofit. 3/4 of hospitals are nonprofit. They can't basically make a huge margin. So what they do is they charge more, And then they pass that extra money on to their executives, to the hospital staff, the surgeons and the physicians, and other labor interests, or they build lots of buildings. So there's this bloat that's occurred in the hospital industry in particular. And then when you say, well, this is ridiculous, we need to spend less on hospital care, they say, but no, we'll go broke because look at our cost structure. It's like, if I go out to the fanciest restaurant in Austin where I live every day, then I'm going to have a higher food bill than the average person. And if you cut my food bill, but if you cut my food bill, that doesn't mean I'll starve. It just means that maybe I'll have to cook for myself, right? Similarly, that's what hospitals say is, oh, we're going to go broke if you pay us less money, when in fact they have a bloated cost structure that has absolutely no discipline. So that's a huge problem. And one key thing that conservatives in particular have to get around is accepting the talking point that that reining in or having a more competitive orientation around hospital prices is somehow impossible because of quote unquote cost shifting, which is just not a thing. And then your final question, I'll answer very briefly in terms of why is it that specialist surgeons are getting paid all this money and not primary care physicians? That's driven largely by practices that started out in the early days of employer-based insurance and then Medicare. Basically, the way Medicare pays for primary care versus the way Medicare pays for specialist surgical care is such that it's massively rewarded those special surgeons. We have this, you want to talk about crony capitalism? One of the most ridiculous crony capitalism things we do is the specialist societies basically have created this group that meets in secret and basically tells Medicare what to pay them. It's this massive conflict of interest. It's called the Ruck Committee. And yet we basically don't do anything about it. We let this happen year over year where the specialists decide what they get paid. The primary care physicians basically get left in the lurch, and that system gets reinforced year over year over year. It's an incredibly destructive crony capitalist system, but because doctors vote Republican, we don't seem to want to do anything about it.
All right, well, thank you. Bob, I'd like to throw it over to you on this transparency issue. So next year, hospitals are going to be required to divulge the prices they pay to insurance companies for something like 300 services. How far do you think this is going to go in making prices more competitive and affordable? And I also want to ask you about telehealth, which is the rage now under COVID. Providers are seeking pay parity, and Medicare is working on that. Shouldn't telehealth be cheaper?
Sure, a couple things. First of all, you'll find that I'm probably going to dissent somewhat from what Joe said on transparency. My colleague, Jesse McBurney, and I just wrote a paper on the whole idea of transparency, and in particular, mandatory transparency. You can find it at our website, mercatus.org, mercatus.org, and just search on my name and you'll find the article on transparency. Due to a number of reasons, and in particular, one that's known in the economic literature as tacit collusion, when you have a market that's characterized by a small number of competitors and very high barriers to entry, adding in transparency, whether mandatory or even sometimes voluntary, you can end up with actually less competition and prices going higher. And the fact is, in an awful lot of healthcare markets in America, the first two conditions, small number of competitors and high barriers to entry, are already in place. Now, there are other problems with it, with the idea of mandating transparency. First of all, I would remind a conservative audience that it's mandatory, and that should imply something right there. My friend Keith Smith, who is CEO of the Surgery Center of Oklahoma, which is probably the pioneer in America of transparency in medical prices, will warn and has warned that mandatory transparency is a problem because if you mandate it, the insiders, the big guys, the ones who are already well established, will write the rules that end up being imposed upon potential challengers. And as a good friend of mine, Devin Herrick, in Texas, has said in response to some of my writings, Transparency grows out of competition as opposed to competition growing out of transparency. Now, switching over to the other topic, telehealth. Yeah, the parity issue is an interesting one, and one on which I can be quite ambivalent. So two of my colleagues at Mercatus, Jared Rhodes and Darcy Bryan, and I have written for the last 4 years something called HOAP, H-O-A-P, the Healthcare Openness and Access Project, where we compare basically the competitiveness, the openness to markets in each of the 50 states in DC. And we have a variable in there that, you know, Medicaid pays parity for telehealth vis-a-vis in-person health. Well, we've always included that, but with a big asterisk and quite a bit of heartburn. We are happy that Medicaid, in many cases, will pay for telehealth. We consider that an improvement. But the parity aspect creates problems. One of the great advantages of telehealth ought to be that it's less expensive to produce than in person. You're not paying necessarily for bricks and mortar. You can smooth demand processes, demand patterns across the country, across geography, across time. Parity can lock in. Oh no, you cannot enjoy the greatest benefit that telehealth has, which is lower costs. And recently, and again, if you go to the Mercatus site, I just submitted a public interest comment to I guess it was to CMS, to Medicare and Medicaid Services, saying that you might want to take a second look at your parity rules and perhaps allow you to pay telehealth up to the level of in-person health, but let you pay less if the telehealth company says we're happy to charge less if we can provide it less expensively, thereby expanding market share, that sort of thing. And I'll turn it back over to you at that point.
All right, good. Joe, I'd like to talk to you about drugs, drug pricing and data, your expertise. So on drug pricing, drugs in the US cost more than other countries, but the US, of course, gets early access to life-saving treatments. Should our government leave drug prices alone? And if yes, how can the US, I kind of have an idea how you're going to answer this.
Yeah.
How can the US be assured it's not being exploited by an industry, pharma, in this setup? And then on data, I want to ask you about electronic health records. So this was supposed to revolutionize medicine when it was launched over 10 years ago. And, you know, under COVID, we have situations where health departments are still faxing data to the CDC. How does that happen? What happened? Did we just miss an opportunity here?
Yeah, well, so let me start with the second one. I guess I'm the tech guy here. So I'm a huge fan of making, getting EHR everywhere. But the Obama administration really showed us this great lesson why top-down doesn't really work. And so what they did is they paid everyone to adopt electronic health records right away. And what this meant is the existing electronic health records that were already out there got to go everywhere. So Epic and Cerner got to go everywhere. And it turns out the existing groups are very bad at working with others. They're closed systems, and they pretend they're open systems, but they're not. Probably over 100 companies now I've worked with that are upstart technology companies trying to integrate with these systems, and they cannot integrate with them. And so what you did as a government is you didn't mandate interoperability, you didn't mandate transparency, you just mandated adoption of these things. And so of course you got adoption of the really old players that are very hard to work with, and it was a total disaster. And there's like smarter policy, which is one thing, which is, okay, if you're going to mandate you adopt electronic health records, you should also mandate a certain type of API interface that can be accessible and where patients have a right to have electronic access to their data with penalties if they don't get it. I think that would be the next good step here if you're going to have to do it top down. If you're working with markets instead, you should not have mandated they have to adopt these things right away, because then it forces them to make the bad decisions. And you have a corrupt monopoly being forced to adopt something, of course, it's not going to end up well. So at this point, it's such a mess that we probably should actually add to the mandate interoperability. We should add penalties if patients don't have access to their data. And what that would allow us to do is allow us to start companies that would then get patients access to their data, and it would kind of create an open ecosystem of competition, and that would at least simulate, very much an open free market. And so there's a lot we can do there. if you require that plugin. And if you don't require it to be open, the big companies are not going to let it be open. They're going to keep it to themselves. It's a huge war we're fighting right now, trying to break into these things. And there's all sorts of strategy that my friends and I are pushing, but the main thing would be great is just require them. So that's number one. Let's force that open and transparent. Yeah, on the drug pricing one, I think we kind of addressed it a little bit before. I do think America is the most innovative country, and it is important. Pharma makes a lot of money, and listen, I'm personally going to make hundreds of millions of dollars off of investments I do for my funds in new therapeutics, and I wouldn't be doing those investments that are saving lives if I wasn't going to make money. So I'm not some kind of crazy person here. You need a market that lets you make money. Now, at the same time, the government needs to negotiate. We should have things like IPI. We should have things like transparency on middlemen, and we should be really careful about patents and make sure patents only last as long as necessary and aren't easily abused. So there's kind of both sides here, and we need to make sure that pharma is not too powerful in terms of how we're basically pushing back against them and creating open markets there.
All right, gentlemen, we just have 5 minutes left, and I cannot let you go without asking you, maybe about 10 minutes. So maybe we can go a little bit longer on this. I can't let you go without asking you a question related to the pandemic. So we are 6 months out, and we are still dealing with a virus despite extreme lockdowns and measures to get this under control. There's a case to be made for retail health that if consumers paid directly for healthcare, that we would be spending a lot more money and getting better value for our buck. If there was more retail health, if it was more free market, do you suppose that the country would be more ahead of this virus than it currently is?
I think that there's there's a modest case to be made for that. Retail healthcare, in particular, direct primary care can certainly play a role in getting people the everyday healthcare they need that can be useful in times of a pandemic. We see, for example, with COVID-19, there's more severe illness if you have a lot of chronic conditions like obesity, high blood pressure. And so a failure to have good access to primary care under the current model, particularly in Medicaid, is a big driver of high obesity and other chronic conditions prevalence in the US. So that can help. But we also have to be aware of the fact that the vast majority of spending on healthcare in the United States occurs in the hospital setting, in the pharmaceutical setting, and in the specialist physician setting. That's where the vast majority of the spending occurs. And so, yes, there's a lot we can do to improve transparency when we should. I will quibble a little bit with Robert's, libertarian absolutism on this. You can't create a market given how distorted the government has distorted it. You can't create a market without opening up, using the can opener to open up the transparency a bit. But those things can help, but at the end of the day, those massively high, unjustifiable prices that are completely divorced from the value or cost of the services being delivered, that's not really happening at the retail level as much. The retail market is reasonably efficient in terms of the price. If you pay cash to a primary care physician or you go to a minute clinic, the prices are not generally that unreasonable for that sort of getting a flu shot, for example, or getting an x-ray. But when you start having the insurance involved and you start basically that the hospital can name its price because you don't see the ultimate cost, that's when prices are out of control for those big ticket items that go way outside of your deductible.
Bob, what is your thinking on it?
Sure, I'm going to have to go at Ovik first. Libertarian absolutist. I've never described myself as a libertarian. I don't think anyone's described me as an absolutist. So I think the combination is just actually under the laws of physics is impossible. But anyway, that said, I don't know whether more retail health would help. If I thought I knew that, I would be calling for more government involvement in healthcare, and I'd be a central planner. I tend not to know what any new market structure would do. What I am confident of is, though, that our current set of laws and regulations prevent markets from forming. They prevent us from asking that question in a meaningful way. It prevents us from finding out the answers. At both the federal and state levels, laws and regulations stifle the sort of market dynamics that drive the whole discovery process, that allow us to answer that question of whether it will help. And the rules that I'm describing in those dynamics don't necessarily concern just the structure of federal health insurance law. And I think we have focused far too much of our attention in the last half century on federal health insurance. Rather, it also includes laws and regulations about professional licensure, medical education, availability of telehealth, scope of practice, corporate practice of medicine. As Ovik mentioned, direct primary care is a very important one, and so forth. Certificate of need, electronic medical records. So I don't know that it would help. I'm sure it would help in some places, but I think we aren't even giving the economy the chance to ask the question and find the answers.
Yeah. Joe, the way our market is run, do you think that has prolonged this virus and the way we're dealing with it?
Oh, of course. Of course. There's just so many obvious answers you aren't allowed to do and you aren't allowed to try. And it's by the way, there's multiple different types of cartels in our economy as well as government mistakes that have led to this. And we could have had a contact tracer out privately. We had one ready to go on Apple that would have worked like, a month after this came out. It was super viral. Everyone would have been using it, by the way, and you could have tracked this down. You could have been testing everyone everywhere where it was and have full intelligence on this. And it's a combination of Apple itself being a cartel, which is a totally separate conversation, and not allowing us to publish this and blocking it, and on top of government incompetence. And so there's lots of different ways we should have tracked this down. With a free market, we could have coordinated to do it. A lot of my friends and I tried to coordinate to do it, or like stymied every single place by government, making it too hard, as well as a couple of the big dominant companies.
Yeah, I think that was one reason why a lot of people had queasy feeling about some of these contact tracing apps, but who knows?
When government does them, it's queasy. If you do one that people can opt into that's super viral, they would tell you, just imagine you have a phone and you're going to walk in somewhere and you instantly know if the people around you had it on it or not. And if you did walk in somewhere where people didn't have contact tracing on, it would then report it to anyone else who might see you. And you can opt into that, because what you do is, I'm not going to see you unless you're being contact traced. And then it'd be something that would be very viral, because you're going to see someone, you say, okay, get on this, so everyone knows that everyone I'm seeing is contact traced. It'd be an easy thing to opt into if you wanted to. And then you could have let people choose that or not. And instead, we just made it impossible to do that. I'm not allowed to do that. The platforms wouldn't let us. And so I think individual choice is important here, not government forcing it. But if there is an individual choice, then that would have been nice to be able to prove, and we were never given that option.
Well, gentlemen, this has been an excellent discussion, and we've run out of time, unfortunately. Thank you very much for your thoughtful responses. And maybe real quickly, anyone want to give a plug for where people might hear more from your work?
Oh, but I want to hear about your new bill you're putting forward here. Come on, just plug that again. We need to see this.
Oh, thanks, Joe. So the Free Up has, we've worked on all these issues, as I've mentioned, and we've put some links in the chat. There's actually now a bill introduced in both the Senate and the House led by Mike Braun in the Senate and Bruce Westerman in the House, called the Fair Care Act, that incorporates a lot of the ideas we're talking about on direct primary care, on transparency, on bringing competition back to hospital care, physician care, the biotechnology industry, the pharmaceutical industry. So there's a lot of stuff in there. If you go to freeop.org, the first link on the homepage is to this article about the Fair Care Act if you want to read more about it. And we'll be writing a lot more about it soon. So just find me in the chat if you want to learn more, or go to our website. Thanks a lot, Joe.
All right, good enough. Bob?
Sure. You can go to mercatus.org, mercatus.org. You can either search on my name, or you can just search on health. I've got an awful lot of stuff there, but so do my colleagues. And I'll mention specifically that I think Mercatus has established itself as the preeminent research source on certificate of need laws and the problems that they produce for the healthcare system. So go to mercatus.org, and you'll be able to spend the next 6 months of the pandemic just going through our literature there.
Good deal. All right, Joe, you want to talk about the Cicero?
Yeah, it's just Cicero Institute. There's about 10 of us now, a lot of economists and legal minds, and we're trying to help make markets work so the best ideas can win in different areas of society, and healthcare is the biggest one. So CiceroInstitute.org has a lot on this too, and I'm fans of the other guys' work as well as in yours as well.
Excellent. Thank you all for your time.
So I'm going to start with Nick Sorrentino. And the question is, will it curb crony capitalism and expanded public care option, or will it just make a bad situation much worse?
Well, I appreciate that big fat softball because that's the best way to start out a discussion like this. It would make things much worse. Basically, crony capitalism, the fusion of corporate interests, other private interests, and government. Well, Medicare, expansion of Medicare, Medicaid, public option. The first people who will be in line, the people who will benefit the most, will be the large vested interests that are making money now and have already partnered with the government. It will only, I liken it to a coral reef. We've got the foundations of the coral reef. Throw some more federal money on top of it, and it's going to grow even more. And the big guys are going to get paid, and the small guys are going to get shut out.
Wow. Okay. Well, now I'm going to move it to Michael Cannon from the Cato Institute. What is your response, Michael?
Thank you so much for having me. I think I have to answer the same. It's just going to make a bad situation worse. If you think about it, we already have multiple public options in the United States. Medicaid and the Affordable Care Act are like public options for people who can't or don't want to buy renewable term health insurance, or what we call short-term insurance at market rates. The traditional Medicare program is a public option for people who don't want to enroll in a Medicare Advantage plan or pay for their own health care. There's tremendous cronyism on behalf of all of these public options, including attempts to cripple the competition. Many states have banned short-term health insurance because it competes with the Affordable Care Act. It competes with Obamacare, and a lot of people prefer it. That's why they want to ban it. Congressional Democrats have proposed doing the same thing, which would throw sick people out of their health plans and leave them with uninsurable pre-existing conditions. So this has happened under the rules that Democrats want to impose for short-term plans. And they want to do that just so Obamacare will work. Single-payer advocates, when it comes to Medicare, they want to completely eliminate Medicare Advantage plans. They don't want to leave anybody any choice. And in the meantime, though, they'll settle for anything that makes those plans less attractive to consumers. And even Democrats acknowledge that there's tremendous cronyism here in these public options. The CBO, for example, the CBO projected that Obamacare would cost $2 trillion over its first 10 years of operation. Congress paid for half of that with tax increases, and the other half by reducing the growth of Medicare spending. That means that even Democrats acknowledge, and they said that it wouldn't affect Medicare's ability to deliver the promised benefits to enrollees. So that means that even Democrats acknowledge that Medicare is so inefficient that they could find $1 trillion of unnecessary payments to providers. And that raises the question: if government programs are so inefficient, why that you can find $1 trillion of waste, why are you creating more? But we'll leave that question to the side. Instead of attacking those government programs and all that cronyism, however, what did Republicans do? Republicans, they attacked the spending cuts in Obamacare, which really proves the maxim that that Democrats create opportunities for healthcare providers to rip off taxpayers, and Republicans make sure they do.
Okay, that's a very interesting response. And if you would, for our listeners, would you define short-term health insurance and how it differs from the traditional health insurance? Just because I don't think everybody completely understands how those programs work.
Well, it actually is more like traditional health insurance than anything else that's available in the United States right now. Short-term limited duration health insurance is a category of health insurance that's completely exempt from all federal health insurance regulations, because Congress just created this exemption in 1996, and Congress didn't touch it when Congress enacted Obamacare in 2010. So there's still this category of health insurance that where the government is not driving up the premiums and making the networks narrower. And as a result, the premiums for these plans, because they use experience rating or underwriting, they can be 70% lower than premiums for Obamacare plans. And they can offer broader networks. And thanks to some a broader interpretation of that exemption that came from the Trump administration a couple of years ago, those plans can actually offer you protection against your premiums going up if you get sick during the term of that contract when you go to renew, which provides what we call a renewal guarantee, which means if there's enough flexibility in this exemption in federal law for these short-term plans to provide long-term protection from the cost of an expensive illness, and not only compete with Obamacare to see which can make access to healthcare more secure for the sick, but can actually reduce Obamacare premiums. Because if you get someone into one of these renewable term health insurance plans, when they're healthy, then they get cancer. If their premiums don't go up, they're still paying healthy person premiums, they can stay in those plans. And that's one sick person that you've kept off of the Obamacare exchanges and who otherwise would be increasing premiums on those exchanges. So this is actually a win-win all the way around. But Obamacare supporters have an ideological objection to this free market alternative competing with their government-run scheme of Obamacare. And so, as all public option advocates do, they are trying to kill the competition.
Great. Let's turn to Grace Marie Turner now. What is your response to the situation? Do you think is the expanded public care going to improve things or make everything worse?
You know, I think Michael really has identified it. Government does not like competition. When you talk to liberals and they have a sort of a revealing moment of truth, they say, if we could just control it all, then we could fix this. They really believe that single centralized control is the centerpiece goal of their policy agendas. And so they don't like a lot of competing players out there. As we've seen, as Michael said, in a number of states, the governors have reverted to the original 90-day limit for the short-term limited duration plans, when the Trump administration has expanded availability to renewal of up to 3 years. And one of the reasons that the states have shut them down to 90 days, which makes them really certainly not insurance, is because they don't want the competition. They don't want the competition with the exchanges. These plans are more affordable. Oftentimes, they actually have much better coverage. They have greater access to doctors than the exchange plans do, and they don't like the competition. And frankly, I've seen over so many years in Washington that Washington, they would rather deal with a few big players than a lot of competing players providing a lot of different choices. But yet what the American people want is more choices, more affordability, and we have seen over and over and over that when Washington gets involved, they reduce our choices, they increase prices, it takes more and more government subsidies to keep these programs afloat, and the last person that has control over what's happening in the system is the patient, is doctors and patients. So the only way we're going to get doctors and patients back in charge is by devolving power away from Washington into the hands of states and ultimately people to be able to make more choices and to have a truly vibrant competitive market. And that means a lot of players. The public option would shut most of that down.
And that's an excellent point. And I wanted to bring over that point to the next question, which has to deal with competition and price transparency. So both President Trump and Vice President Obama, that was a slip, Vice President Biden have said that they want to lower prices for pharmaceuticals and for medical services, and that they want to create greater transparency. And so would this situation work? There was a case just last week in the DC District Court, which went before a 3-judge panel in which the litigants for the American Hospital Association were arguing that the price of an X-ray was unknowable. And this panel, which included Judge Merrick Garland, in their response, they said, how is it unknowable? Why is it unknowable? And I asked the same question. Is it unknowable, and should it be unknowable? So in this case, I'm going to start with you, Grace.
One of the many things that the Trump administration has done to try to improve the market is to require transparency. Of course, these are battling out in the courts, but people want to know how much something costs. I just read about a a treatment for COVID. I think it was a COVID test that was thousands of dollars. I mean, and people are just shocked by these big bills because they cannot know in advance how much something costs. The reason that the hospitals, doctors' offices, when a patient asks them how much does it cost, oftentimes they really don't know because they don't know what is the contract with insurance company A paying them for this particular service, which may be a different amount than the contract for program B. If we had more transparency, more consumer engagement, so people had an incentive to want to get lower prices because they have actually the potential to save money or get better care, then the market would be forced to respond to them. Right now, it's forced to respond to all these big third-party payers, whether it's government or whether or not it's the private sector. And we've seen that this can work. New Hampshire, for example, the state of New Hampshire decided that it was going to set what we call reference pricing. That if you need, for example, a knee replacement, the plan would pay just an average, I don't remember the exact number, but something like $25,000. Well, if someone could find a physician to do that procedure for $20,000, they could save the difference. They could save that $5,000. But maybe they want to go to the best surgeon in Vail, and he charges $35,000. Well, they can pay that extra $10,000 themselves, get what they may consider to be the very best care in the country by paying extra. But it doesn't happen if consumers don't have an incentive to shop for those prices and for the marketplace to reveal those prices to them.
I'm going to now turn to Nick. What are your thoughts on this?
Well, one thing we got to keep in mind always is that insurers at this point almost act as quasi-government agencies. The prices that these insurance companies come up with, and I say this as somebody who has family on the very front lines, the opacity that surrounds the whole system is very much by design, and it is very much because the vested interests want it to remain opaque. One of the things against crony capitalism we talk about a lot is a free price system. To the degree that an economy can have prices move so that we can get proper price signals, that will benefit consumers and society in general. Well, in healthcare right now, we don't have anything close to a free price system for multiple reasons. When we talk about the price of drugs, why is X drug, $100 a pill? Well, the pharmaceutical company will say, well, we had to put it through the FDA, and that was, $1 billion worth of, approval or research and so on and so on. Well, then you start to get into what are the real costs and what aren't the real costs. And that equation is extremely complicated. So to the degree that we can kind of start to peel some of that back, we should.
Well, that makes a lot of sense. So Grace, Michael, your thoughts?
So mandates don't work, in part because they get captured by the industry, and the industry uses them to their advantage and to block competition. But they also, transparency mandates aren't going to work also, as Grace Marie says, if the consumer doesn't have an incentive to use the price information. If they're spending someone else's money, nobody's going to care. So if you give consumers control of the money, then they'll demand transparent prices. They'll get them, and they will change their behavior. She mentioned, I think it was the New Hampshire experience with reference pricing. There was an experiment in California that found that when the state of California said, we're going to pay $30,000 for hip and knee replacements, but if you want to go someplace else, you're going to pay the balance. Consumers demanded price information from hospitals. They drove down the prices for knee replacements at the high cost hospitals in California by 37%, $16,000 per procedure. You have to change who controls the money so the consumers have an incentive to care about the prices. And once you do that, you don't need to mandate price transparency anymore. But that's not all. You also need to get rid of regulations that are enabling healthcare providers to price discriminate, charge higher prices, and so forth. One example is this. This is a Narcan nasal inhaler. It's an antidote for opioid overdoses. This is an incredibly safe drug. You go through a training to use this. It takes about 5 minutes. It's got no abuse potential. It's got almost no side effects. I could give it to myself right now and I could finish the rest of this Zoom. This thing saves lives. We lose tens of thousands of lives every year to opioid overdoses. There's no reason that this should require a prescription. The FDA yet nevertheless requires people to get a prescription in order to purchase one of these. And even they recognize they shouldn't be doing it. They went to the manufacturer and said, look, here's the label that you need to submit to us for us to give you an over-the-counter designation. Just like sign at the bottom and we'll do it, which reflects a little bit of cowardice on the part of the FDA. But when we at the Cato Institute had a briefing on Capitol Hill about why naloxone should be available over the counter instead of by prescription only, before that event even happened, we got 4 different Cato employees received phone calls from 4 different lobbyists representing the manufacturer of Narcan, which is this inhaler right here, arguing that no, the prescription requirement should remain in place. Here you have a drug manufacturer arguing for a government regulation that makes it harder for people to purchase their product, to obtain their product. Why is that? Well, the reason is that if the drug is prescription only, it's easier to get insurance coverage. If you get insurance coverage, you can charge much higher prices. So we need to get rid of unnecessary prescription requirements and other government regulations that stand in the way of price competition as well. As it happens, we at the Cato Institute are releasing a study today about eliminating unnecessary prescription requirements, the importance of doing so. And naloxone is one of the examples we use, and you can find more about that at cato.org.
Excellent. That's a great resource. Thank you. I am actually going to stay with you for my next point, Michael. One thing that we've talked a lot about is COVID and the impact of COVID. We discussed this in the last panel. One area that has come up that actually might almost be a positive side effect comes into the area of right skilling. As a result of COVID, as many of you have written about, we have suddenly waived some of the education credentials or some of the training credentials for a healthcare service provider to provide some type of service. And an easy example to understand is that something that we ordinarily would have a registered nurse do, we now have an LPN do. And again, when we look at this, what causes the costs of medical services to go up so much is the training and education of the service provider. If the doctor is doing something that a registered nurse or an LPN could do, of course, it's going to cost more. So we have seen these waivers happening. And I know, Michael, that you've written about this recently. Could you talk a little bit about what you see the benefit of these waivering of the credentials or the enabling certain people to have more power in their positions in terms of the specific tasks that they are now able to do based on their current credentialing, and then just over the last 7 months or so that we've had COVID in place, do you see that any of this is going to stay in place, or is this just a short-term situation?
This is great. You gave me a chance to talk about the paper we're releasing today and a chance to talk about the paper we released a few weeks ago.
I planned it ahead of time just for you.
I do appreciate that. A few weeks ago, we, the Cato Institute, released a paper about clinician licensing. And this is one of the worst, most underappreciated areas of cronyism in healthcare. Because every year, what incumbent clinicians do, from physicians to physician assistants, nurse practitioners, and on down the line, is they use these rules that are supposed to protect consumers. The rules surrounding who gets a license to practice medicine in the state, what tasks can you provide, and so forth. And they use those rules to restrict competition from other categories of clinicians who would compete with them for patients' business, and from new entrants into their own profession by increasing educational requirements and so forth. So that right now in 28 states, for example, you have laws that say that nurse practitioners cannot practice independently. Those laws are put there at the behest of physicians who don't want nurse practitioners competing with them in that way. And in those 28 states, nurse practitioners have to pay physicians for a supervision arrangement that can cost $5,000 or $15,000 per year and increases the cost of primary care, particularly for the poor. So these laws restrict access to care for the most vulnerable people in our society. And the amazing thing about how the COVID-19 pandemic affected this area of regulation is it made it completely obvious to everyone that these regulations restrict access to care. Because the first thing that happened, and it happened almost instantly, once people realized that there were going to be waves of this illness hitting individual states, is governors, state legislators, regulators said, we are suspending these regulations because we need to suspend them in order to meet the public health crisis that is coming our way, which was an implicit recognition that these laws restrict access to care. Of the 28 states that prohibit nurse practitioners from practicing independently, 5 of them completely suspended that barrier and said, if you're a nurse practitioner, then for the duration of this public health crisis, you can practice independently. They were Kentucky, Louisiana, New Jersey, New York, and Wisconsin. An additional 16 states partially suspended those regulations prohibiting nurse practitioners from practicing independently. My own state, the Commonwealth of Virginia, was one of them. Incumbent physicians were very upset about this. You should read the angry letters that the Virginia Medical Society sent to the governor of Virginia saying, why you didn't even consult with us before you did this? How dare you? And demanding that those regulations snap right back into place once this public health crisis is over. There's no evidence that the 22 states that allow nurse practitioners to practice independently are seeing any ill health effects as a result of this. But the physicians want those regulations in place. In part, I think in large part or mostly because they know that nurse practitioners will be competing to provide basic primary care to people and be doing it in a more affordable way. And that's going to cut into their revenues. So we wrote that paper because we wanted to capitalize on this learning opportunity, this teachable moment, and educate people about how clinician licensing laws actually make patients less safe, and argue for keeping some of these suspensions in place, making these temporary suspensions in effect permanent, so that in those states and in other states as well, nurse practitioners will be able to practice independently. And right now there is a law in California that has been sent to the governor that would do that. I haven't checked in a little while. I don't know the status of that law, whether the governor has signed or vetoed that law, but there has been some momentum in this area. And I think that's a hopeful sign.
Well, that's good news. That's good progress. So now I'm going to turn to Grace Marie.
Now, I think it is really important for all medical professionals to be able to practice at the top of their education and training. The Physicians Foundation has found that we are facing a physician shortage of up to 120,000 physicians over the next 5 years. And so we absolutely must be able to have every medical professional be able to practice again at the top of their education and training. There are some moves to allow some nurses to practice as physicians. And I think that some patients, I mean, I know all of us can talk about anecdotes, but there are certainly instances where they just miss something major and a patient can have serious consequences and complications as a result. I think the answer to that is going to be technology. And we've seen, as Michael said, in the COVID crisis, we've seen a lot of relaxing of rules and regulations, including in telehealth. And there's no reason why a nurse or a nurse practitioner couldn't be able to tap into a sophisticated database, the Mayo Clinic database, or to be able to have a physician on call if there is a complication that he or she don't feel that they can handle. So there's a really valuable mosaic potential with physicians not only being able to practice at the top of their training and education, but also across state lines, being able to use technology more efficiently to be able to really get the best diagnosis. My colleague Brian Blaze has written a paper about the value of artificial intelligence in diagnosis. Well, once again, physicians are blocking that because the artificial intelligence diagnosis, even though it's much better and much faster, reduces their revenue. And so it's really, there is a huge pushback from entrenched interests in the health sector to really improving care. And the only way that that is going to ultimately break down is when consumers demand more efficient care, higher quality care, and the care being able to, and more affordable care, because of the smarter use of our healthcare system. And that is going to require a lot of changes at both the state and federal level to relax these laws that are making healthcare so expensive and really inefficient.
Okay, and Nick, you want to round us out?
Yeah, so I mean, what we're seeing here is COVID has come along and forced everybody's hand. All right, so we're looking at, a marginal revolution, which could be a revolution depending on how long this lasts in the healthcare industry. Now, I live in Charlottesville, a stone's throw from UVA Medical. I know a few doctors, and the politics around doctorness. Hey, all right, go Who's. And a big problem is the deification of doctors in our society. So for so long, we have looked to doctors. If you look back at doctors in the 1800s, for instance, they actually earned less than the average professional wage. Then as the AMA came in and, all these sorts of other sorts of regs and different groups and so on came in, pay went drastically up along with status in society. Now, obviously, a good doctor is a wonderful thing. And I'm a big fan of good doctors. I know a couple of them. But the truth is, depending on what type of doctor, but a general practitioner, there's no reason why, a nurse practitioner can't do most of the day-to-day work. In fact, I've gone out of my way to work with nurse practitioners on a personal level, just to see if it made sense, and it does. So, we have a society that basically is moving in one direction, and we have an ossified industry that is just holding on that basically we need to break through. Now, that's no news to this crowd for sure. But it will be interesting to see the degree to which the change that COVID has brought will start to create cracks here and there. It looks like we've seen some of them. By the way, Michael, I have to say, I'm impressed by your expertise, and Ms. Turner, you as well, of course. But your analysis, I appreciate.
Well, I think there's definitely some elements of COVID that we're going to hold on to. And the telehealth is something that has become pretty popular. People are realizing, okay, if I can get the same diagnosis and I don't need to go to a doctor's office, it's easier on me. I'm more informed as a consumer. And I think that trend is probably going to continue. So as we're nearing the end of the panel, I do want to end with a broader question. Every year we do this crony capitalism conference. This is the fourth year, and we talk about different topics. This year we focused on healthcare. Last year we talked about the opioid crisis. Another year we talked about technology. While we will never be able to completely eradicate cronyism, are there ways in which we can look at industry and government and their relationship and find ways in which we can minimize it? So I'm going to start with you, Grace Marie.
I've had a chance to talk with a political appointee, Trump administration appointee, who was working at OSHA. And he said that this administration really has a very different approach to working with mines and other high risk employers, job settings. And he said, unlike past administrations, we go in and we figure out where might something be going on that's unsafe. How can we work with you to make this stay safer, rather than an adversarial relationship? This administration is really trying to help industries do better to avoid avoid injuries. And I think that that's really what it takes. It takes a different attitude by the administration to try to help and figure out how can we make this work better. We talked earlier, Leonore, about prescription drug prices. What the Trump administration has been doing is trying to figure out why are drug prices so high. Well, one of the reasons is because it usually takes 10 to 12 years to bring a new drug to market and $2.5 billion in investment. Then they are saying, what can we do to make the drug approval process faster and more efficient? Still safe, but are there ways we can use technology? We can, again, partner to try to do a better job of accomplishing the same goal, but in a more efficient way. And as a result, we've seen greater use of generics, faster production of generics. Drug prices actually had their lowest increase in decades this last year. So I think that those kinds of things show that if there is a partnership and a willingness between government and the private sector, and especially with government, getting these unproductive, useless, expensive regulations out of the way so that the private sector can respond. As we have seen in the COVID response, we've seen warp speed creation of new treatments and hopefully vaccines for COVID. We've seen factories be able to turn their factories around almost with a World War II level mentality of producing supplies that may not be their expertise, but they can figure out how to do that in order to help with the larger public effort. So I think it's consumers, as we were talking about earlier, having more power to force the market to respond to them, but also it requires government having a different attitude in its relationship with the private sector, not adversarial, but figuring out how can we work together to achieve the goals we all are trying to get to.
Michael, your thoughts?
My thoughts are that Nick is my new best friend. Also, so thank you and wahoo wah, and in solidarity with Bob Grayboy, so my fellow panelist, I've also got my George Mason University degrees up there as well. So look, the only way to get rid of cronyism, and I should go on record, I hate the term crony capitalism. I don't even like the word capitalism because I think it misrepresents what a real goal is, which is freedom in free markets. And capitalism, it like sounds elitist and exclusive, and it's not about capital, it's about freedom and improving people's lives. But I really don't like the term crony capitalism because that makes it sound like the problem is the capitalism. It's not at all. The problem is just the cronyism. It's the fact that we're giving government power over other people's lives, and then some people come and capture that power and use it for their own benefit. And oftentimes they do this with the best of intentions. I mean, yes, there are bootleggers and there are Baptists, and they both might support blue laws in the South, but it's not always so clean a delineation between the bootleggers and the Baptists. I mean, some of the people who profit off of these sorts of subsidies and regulations also believe very much that they're doing good while they're making money. So, and the only way we're going to reduce cronyism and reduce the amount to which the healthcare sector rips off the American people is when we take those powers away from the special interests by taking them away from government. I really liked Ovik's line from the first panel where he said that the biggest middleman of them all is government. If we want to eliminate cronyism in healthcare, we've got to take our money back from the government. 50% of all healthcare spending comes from the government. At least we should be giving enrollees in government programs like Medicare cash, like Social Security does, and trusting them to spend it. That right there will dramatically reduce the opportunities for cronyist, rent-seeking, lobbying on the part of the industry. And then we should be changing the tax code so that our employers aren't controlling $15,000 of our earnings and using it to choose a lousy health plan for us that disappears when we get sick and can't work anymore. Return that money to the consumer. Then it'll be easier to get rid of all of these regulations like the unnecessary prescriptions and the clinician licensing rules and health insurance regulations that that benefit certain corners of the industry at the expense of taxpayers, because it'll be much clearer to everybody that that this regulation is hurting your pocketbook, because look at how much it's increasing the health insurance premiums that you're paying every month. Right now, we're not paying our health insurance premiums ourselves, so we don't even know. But only when we take these sorts of steps to get the government out of healthcare, rather than try to have the government manage healthcare better, are we going to eliminate this cronyist rent seeking. And maybe, just maybe, we can knock healthcare off of the #1 spot on the list of industries in terms of spending on lobbying the government, because healthcare has been up there in the #1 spot for about 20 years, and it's not because we have a free market. It's because we have so much government control over our healthcare sector that the healthcare industry wants to throw so much money at lobbying in order to influence how government makes those decisions.
All right, Nick.
Well, one important point, having co-founded against crony capitalism, we've been around for 10 years now. This is the debate over the term crony capitalism is one I've had many, many times, and I won't go into all the details. But let's just say I appreciate your point very, very much. But there's maybe some other time we can talk about, you and I can talk about why crony capitalism is actually the apt term. That aside, crony capitalism is the way of the world. All right. Since Hammurabi, and probably before that, there have been, vested interests lobbying the king to get laws in their favor. That is just human nature. And we've had times where it's been better, and there have been times where it's been worse. Well, the 20th century is often called the century of warfare, where it's also the century of the state. Well, we've had a long expansion of the crony capitalist system, and we are certainly due for a bit of a trim back. Now, how does one do that? Well, of course, what we need to do is take our money back. We need to reduce these regulations. Absolutely, okay. But the average person out there, they don't see that. There are people I've been talking to about this for 10 years. They still don't get it. Maybe that's just because I'm not explaining it very well, but I don't think that's why. The system is so entrenched that the only way we can really, and I believe that we're doing some of this work at AC2 News, is what, I'm going to show my intellectual cards here. And, Murray Rothbard said, we've got to show the American people that they're getting ripped off, and just got to keep showing them over and over and over again that this stuff that's supposed to be helping you is actually, to use the parlance of our times, a jack. All right. And to the degree that we can do that, then we have a toehold, then we can start rolling back some of these things. Consider, and this is a subject for another time, but the power of guidances alone in different agencies is immense, and no one even knows they exist aside from a few, policy wonks, and they control our lives. But anyway, so tell the people what's actually going on and just keep hammering away. That's what I say.
Exactly. If you keep telling them that they're getting ripped off, eventually somebody will listen to you.
Somebody.
So I want to just conclude by having everybody go around and just give a quick plug for their entity. So we'll go with Grace Marie first.
Thank you so much. And thank you very much for this opportunity to talk with you and our participants today. The Galen Institute was founded 25 years ago to promote an informed debate over market-based health reform ideas. One of our major projects is the Health Policy Consensus Group. And today we are releasing a full 45-page plan called the Healthcare Choices 2020 Plan. It's an improved version of a shorter plan that we developed a couple of years ago that really is the answer, we believe, to Medicare for all. It devolves power away from Washington through the states to doctors and patients, to families, to businesses, to give them more choices of more affordable coverage. And it does a better job of taking care of people with pre-existing conditions. I'm going to put on the chat room a link to an article that I wrote in The Hill last week that summarizes the plan. And also, it will be available at healthcarechoices2020.org this afternoon, and I'll put a link there as well. But there is, when people say, oh, well, conservatives don't have a plan, Overgroy has a very well-developed health plan with a lot of actual legislation that's been introduced to support these ideas. Conservatives want to organize around eliminating crony capitalism, putting power and control back into the hands of consumers so that they can force the market to respond to their needs for faster, better, cheaper care and coverage, like the market does respond in other sectors.
Okay, and then Michael.
So the Cato Institute has been around since 1977. We are a libertarian think tank. We exist to give a voice in public policy debates to the traditional American ideas of individual liberty, limited government, free markets, and peace. And in healthcare, what this means is, we think you have a right to healthcare in the sense of you have a right to make your own healthcare decisions. You have a right to control your healthcare dollars. You have a right to choose your doctor. You have a right to choose what treatments you're gonna use, and no one has any right to come between you and that willing doctor or that willing pharmaceutical company or what have you. And when the government tries to enforce a right to healthcare in the sense of providing you healthcare, it doesn't secure your healthcare rights. It actually takes them away. It takes them away by taxing you more, which leaves you less control over the healthcare that you receive. It takes them away by trying to keep you safe with mandatory prescription requirements that end up costing lives by blocking access to life-saving medications like these. If we had a free market in healthcare, if we respected people's right to healthcare properly understood, then healthcare would be more abundant. And we'd save more lives, but more importantly, we would be doing more to respect our fellow humans because we'd be recognizing our own place in the universe. It's not, my place in the universe is not that I should be making decisions for you, telling you how to live your life, telling you what kind of doctors or providers or treatments you can use. My role in this universe is maybe to try to persuade you to make better choices if I think you're making bad ones, but otherwise just to let you live your life the way that you want, to trade with you, and so that we can all enrich each other's lives and lead better lives. Unfortunately, we have a terrible uphill climb if we want to have that sort of a society. But we thank you at the American Conservative for putting together this Zoom conference to hopefully move us a little bit closer to that.
Okay, Nick, since you actually have the words crony capitalism in the name of your organization, you get to have the last word.
Thank you. And I also want to express my gratitude to the American Conservative. The fact that you guys have focused on crony capitalism over the years is of great value. We link to you all the time, and we consider you a resource and an ally. So we appreciate that, and thank you for having me on. I'll just say this on the health front. One thing that we didn't really talk all that much about is the fact that people can empower themselves to be healthier. We have a sister organization called the Alliance for Natural Health. It's ANHUSA.org, where here's an idea. Exercise, eat well. It's a crazy thing to think, but if we do that, that solves a lot of these health problems that we've been talking about. Kind of does an end route all around a lot of these problems. But in closing, I'll just say, there's a reason pharma is considered the most powerful lobby in Washington. It's been considered the most powerful lobby in Washington, I believe, by survey for the past 10 years or something like that. yes, we have an uphill climb, and it seems like those of us who believe in free markets and free prices, we always have an uphill climb. To fight crony capitalism, it's always going to be there. We're always going to have to keep our feet chopping. And I say this as a former lineman, a football lineman. You just keep pushing forward, and you just go and you go and you go until you get across into the end zone. And that's what we have to do. That is, to some degree, our lot. And I wish everyone on this call and everyone listening the very best of luck, because we need it.
Well, hopefully that end zone is within our horizon.
Yes,
So I want
indeed.
to I want to thank all of you, and I want to turn it back to my colleague Emil Doak.
All right. Thank you, Leonora. Thank you to all of our panelists here today, everybody listening at home. You can find more of our coverage on crony capitalism issues and on all issues that affect the health and well-being of our main streets, of our small businesses, of our working people here in this country at theamericanconservative.com. You can also check out both of our podcasts, TAC Right Now and Empire Has No Clothes, wherever you get your podcasts. And then you can also support our ongoing work on this front and many others by becoming a member of the American Conservative at our website, theamericanconservative.com. So again, thank you to all of us to all of you for joining us today, and be on the lookout for video of this panel, as well as all of our panels on our website shortly. Thank you.